Namah Shreyatirajaya Vivekananda Suraye Satchit Sukha Swarupaya Swamine Tapaharine Swamine Tapaharine.
So namaste, let us start.
Namaste, sir. May I ask a question?
Yes.
So, actually, can you please elaborate on Prameha part? Because what I understood in the last class is Prameha, uh, and then that leads to, if neglected, that leads to Madhumeha. Am I right?
Yes, Madhumeha is generally the Vatika stage, but it is not simple like that.
Okay.
Prameha itself is a term for any disease characterized by excess urination.
Okay. Then,
Then one of which could be, diabetes mellitus.
okay.
So Prameha is a general term for any diseases characterized by excess urination.
Okay.
But
Then,
specifically, what we call as diabetes mellitus is Madhumeha.
Vatik. That is clearly Vatik, is it?
Yes, it's in the Vata stage that it is generally called as Madhumeha. Madhumehitva apannam, it is told. Because I think the reason is that, there are two things here. There is blood sugar and then there is urine sugar also.
Yeah.
So madhumehitvam means that there is excess glucose in the urine. So even though this distinction is made in Ashtanga Sangraha Hridaya, where he says Tanu Madhuryam and Mutra Madhuryam. Both are two different things. Tanu Madhuryam means the sweetness of the body, sweetness that is blood glucose.
Yeah. Yeah.
So only when blood glucose threshold level goes above 180 or something,
180. Yeah, 180.
yes, then only it starts leaking into the urine.
Hmm.
So with today's knowledge, we can say Madhumeha is when glucose is really leaking into the urine.
Oh.
Because then only Madhumeha is Madhumeha. So you can still be diabetic because your blood glucose levels are above 140. So many doctors tell it is good to keep your blood sugar within 180 because even if you are diabetic, because then it will not cross the renal threshold.
Threshold. Yes.
So the renal threshold seems to be the cutoff point for Ayurveda to call it as Madhumehit. If you look at the exact definition, because when you see it in the urine, then you can say that it is Madhumeha. Till that it is not Madhumeha, it is only Prameha. Excess urination may be there, but Madhumehatvam is when glucose is seen in the urine.
Okay. The what generally what is done is, like, if the fasting blood sugar is more than 135 constantly, they start on at least metformin, something. So it's a wrong way to.
That is now that is being challenged. So there was the direct trial which said that Unless you have a hyperglycemic crisis or completely not under control, a better option is to change your diet and lifestyle and try to control it. Because if you have very high blood sugar, then medication is really
Yeah,
necessary. You cannot take a risk at that time because it can include induce hyperglycemic coma. There can be so many complications. But in the early stages, just because you have freshly been diagnosed as a diabetic and your blood sugar fasting is maybe 140, 150, then the first trial should be with diet,
that control.
lifestyle, and maybe herbal medicines are good at that time also to support. I had once pre-diabetes. I didn't take any medicine. I just reduced my weight, started exercising more, reduced rice, and it came down from 6.4, it came down to 5.4 very easily.
Okay. So pre-diabetes may last for up to 20 years also. It's a 5 to 20 years sometimes.
Yeah, yeah, yeah.
Then
Pre-diabetes, but the conversion of pre-diabetes into diabetes is increasing.
yeah, and faster
Because,
also.
yeah, I'm telling a personal experience. My wife had gestational diabetes, so that predisposed her to diabetes. But since it is about for 13 years now, it has been still maintained in the non-diabetic, pre-diabetic range. Sometimes fluctuating because we by taking care. So if you lead a very loose diet and sedentary lifestyle, then the speed of conversion from pre-diabetes to diabetes will be faster.
Faster. And then one more question is like diet control and all. See, we go by calorie counting and all. If diabetes. Here in Ayurveda, how do they define how much
So,
to
madam,
eat?
are you allopathic doctor?
Yes, sir.
Okay, now I understood why you are asking. So, okay, so now it makes sense why these questions are coming. Yes. So, yes, madam, in Ayurveda, we are not going just by calorie. We also have such concept. We classify food into Guru and Lakhu. Guru is very high calorie and Lakhu is low calorie. So that part is there, but we also look at various other factors like what is the metabolism of the food. In each person, it may be slightly different because a Vata person, Kapha person, Pitta person may metabolize same foods in slightly different way. And also, what is their lifestyle? If they are very sedentary, then we advise avoiding guru foods. Similarly, like modern, also not taking high calorie foods. So we also have concept, but it is not measured exactly. I mean, they just grade it. This is Guru. But Guru Lakhu is not the only factor that we consider. We consider many other parameters also, like constitution of the individual, the place where they are living, the time of like curds taken at night is harmful, but not so harmful if you take it during daytime. So every food is classified in, and their conditions to take are very elaborately described. So generally we would agree Guru Chapatarpanam Sthule Vipari, and Guru and Lakhu also has two meanings. One is that Guru means that which is digested slowly. This is a problem with Sanskrit, madam. Sometimes, one word has multiple meanings. So when because they are all interpreted in the context. So I also found this very confusing in the beginning, whether guru means high calorie or it could also mean lower glycemic index. Because if something is digested slowly and absorbed, then it means it will give you a lower glycemic load. So what we have said is that low glycemic index, low calorie food is one category. High glycemic index, high calorie All these combinations are described as Guru Apatarpana, Lakhu Santarpana. In this way, the foods are classified for Prameha people. So these are all some of the concepts. A very elaborate discussion on diabetes is actually very interesting because Ayurveda, in my opinion, has looked at the drivers of diabetes. We are looking at lipid metabolism. In Ayurveda, it is said that the basis of diabetes is medodushti, not accumulation of sugar. That is only a symptom.
So actually, this I think these are addresses like Pittaja Prameha.
Yes.
Pitta Prameha, sugar is more, but still, I mean, for Pitta, I think Madhura is
Yeah, pitta is more like an autoimmune reaction, and the pancreas getting damaged by something like an autoimmunity. So we say in some people, the prameha may start as, because what we have observed is that when people eating very spicy, pitta aggravating foods, their diabetes is beginning with in the pitta stage itself. So it need not always start from kapha to pitta to vata. In some people, it starts as vata prameha itself. In some people, it starts as, depends on their diet. So I found people from the Middle East and all where they eat more pitta aggravating foods like fried foods, very spicy. In those people, when we are assessing their diabetes, we find they are presenting with pitta symptoms. So for us, this dosha assessment is very important. Apart from naming the disease or diagnosing the disease, we subclassify them based on the doshas. So that gives us. So I think the pancreas is also damaged by autoimmune activity. That concept is there in modern medicine. I have understood, and this seems to correspond to the pitta kind of response. So they did not explain exactly in biomolecular terms, but they understood many of these processes. That things move from insulin resistance in the beginning, where all you need to do is increase insulin sensitivity. Yeah, so that is the kapha stage. In the second stage, pancreas is getting partially compromised. So they've said that now this is not fully curable, but you can manage it well. And then the stage where beta cells are completely gone, and now they are fully dependent on insulin. That is a vatika prameha. So vata prameha, of course, that is a big development of modern medicine. Without insulin, I think people would have been in a lot of trouble. So with insulin, we have now extended the lifespan of people. But still, I think Ayurveda can help because with insulin and supportive Ayurveda therapy, we can control the requirement of insulin and we can prevent a lot of complications of diabetes. I think that's one big area. We can slow the progression into complications with many of our Ayurvedic medications, including Triphala. It's a very good supplement for diabetic patients to prevent microvascular consequences. Okay, so that was a little bit long discussion on Rameha, and
Thank you, sir. It's
yeah,
really
I
useful.
mean,
Thank you.
okay.
Thank you. Thank you.
Namaste, madam. I was very intrigued that you were asking very, very pinpointed questions, so that's why I asked whether you are allopathic doctor. So
Thank you.
So I want to share today. I was telling yesterday that before accepting uh, anything as drug source in Ayurveda, we need to understand so many things about that. This many people do not know this today, and I believe even Ayurveda doctors are not following this concept. They are using everything. Little knowledge about something circulating amongst the, even in modern medicine, I think this is not fully always followed because the medical representatives are pushing the medicine sometimes and doctors are using it. without maybe always fully studying about it. But in Ayurveda also superficial use is happening. But what the Samhitas, I've tried to put it all, and I have not put any Sanskrit here, but just to show how much you must study a substance before you use it. So if you are going to use a medicine in Ayurveda, you must ask whether you know about that in all these respects. Aushadham hi anabhijnadam namarupa gunaistribhi. So if it is not known by Namarupa, Guna and Yukti is also there. Yukti is included in that Guna. You see, without Guna, you cannot do the application. So nomenclature means you must be thorough with the nomenclature of these plants. Codification of names, enumerating it as a timeline, classifying the nomenclature. The Nikhandus have done a lot of this work. If you take Nadvandri Nikhandu, Raja Nikhandu, Madanapala Nikhandu, they've all tried to create this kind of codification and classification. And then you must know the meaning of each of these names. Guduchi, Gudarakshane. Tulasi, does anybody know what Tulasi means? Such commonly we are used. So if you don't know the meaning of the names of all these plants, then you are on a red list. Not a Vaidya. I am not fully, I am still trying to learn about all these things. After I understood that if I should say that I am a Vaidya, I should know the meaning of all names of plants. So Tulana Nasti Iti. Tulasi means it is incomparable. There is nothing Tulyam to Tulasi. You cannot put it on a balance, and Tulasi on one side is always heavier than whatever is put on the other side. So every plant has its own, identifying characteristics. Rajavriksha, Karnikaraha. So this is the Cassia fistula. It's called as the Rajavriksha, the royal tree, because of the way it looks when it flowers. So we need to become very familiar. When you hear the names of the plants itself, the picture of the plant should be triggered in the screen of our mind. Then comes the identification. It's not enough to just know names. You must be able to exactly identify it. So all the botanical features, many plants' botanical features are described in the commentaries. Vartula patraha, or Dirghakaraha, Kantakiyutaha. Like this, so many descriptions are given for the plants. We should be well versed in it. And then we need to know is differential properties of parts. All parts of the plant may not have the same properties. So do we know which part is most potent? Some plants, the different parts have different properties. If you take dadima or pomegranate, the inner, seed and that flesh has a different property. The bark has different property. Kutaja bark has different property. Kutaja seeds are called another drug itself, Indrayava. So Kutaja bija, it is different from Kutaja twak. So in this way, dry ginger and wet ginger are different. Then same plant may have different varieties. It's very, very important to distinguish the properties of different varieties of plants. Then related species. Sometimes, now if you look at Kudaja, two types of Kudaja are there. One is Rhytia tinctoria and the other is Hollerina antidiscendrica. Both are two different genus. Then we must also be aware of substitutes. Sometimes substitutes are allowed. Like Ativisha, it's Aconitum heterophyllum. It's used for children. It's a very expensive plant, but very powerful. If Aconitum heterophyllum is not available, you can use Musta. It's an accepted substitute. Cyperus rotundus. So like that, for But in a formulation, the main drug cannot be substituted. The pradhana dravya should not be replaced. Supportive medicines can be replaced if it is not available. Then you must study about adulterant. So all this study is necessary before we can claim that we have learned and we can use Ayurveda safely. So after all this identification is done, then we have to study about the physical and chemical properties. So if anybody makes any claim about any medicine, you must ask where is the information in all these heads. These are the data heads. Physical, chemical properties, biotransformation. What happens? Biotransformation, what Ayurveda is talking about is what you call PKPD today, pharmacokinetics and pharmacodynamics. What happens when the plant is taken inside the body? Ayurveda is very concerned about that. How will it be excreted? How will it be digested? Which organs will it affect? Will it harm the kidneys or liver? All these things should be known. Then its actual pharmacology should be known. What are the targets? Then risk-benefit analysis. What is its safety profile? Is it generally safe to use or should be used with caution? If with caution, how much caution should we exercise? Will it interact with other herbs? So there is this concept of Shatru, Mitra and Udasina. Some herbs are Shatrus to each other. If you combine them, one will cancel the other. Now in modern medicine, many of the doctors always they ask me, how do you know interaction? They are afraid. Many doctors told me, see, we are very open to Ayurveda, but we don't know what will happen when you combine both. So please don't misunderstand. If you tell us what happened, we are willing to give. So this is a genuine concern. Because we know warfarin interacts with even garlic. If you are on a blood thinner, then if you take a lot of garlic, then you can bleed and die. People should know this. There can be herb food interactions. And then, interactions with foods also. And then when it comes to application, all these things are classified into many, many groups and subgroups. They are having specific disease targets. How can we formulate them? What is the pharmaceutical processing to be done? Is it to be made into a water extract or lipid extract or alcoholic extract? All these three mediums were used in ancient times. There were aqueous extracts. It was water or fat or alcohol. And then the dosage form. In what dosage form should we administer it? What is the dosage? What is the mode of administration? Is it oral or is it rectal route or is it external, transdermal? All these things have to be studied. And then final and most important thing is individualization. We cannot give the same medicine to everybody. How do we individualize it? So this is an overview of all the information that you must have before Ayurveda would allow us to use any medicine. I have shared this in the group. So now we will go to continue. So this is why we were discussing yesterday. Yatha Visham, Yatha Shastram, Yathagni Rashanir Yatha, Tathaushatham Avijnanam, Vijnatam, Vijnatam Amritam Yatha. So we said some like Visha, Samjnanasham Kritva Mareti, some like Shastram, Marmachedam Kritva Mareti, Kinchit Chagnivat Spodhadigam Kritva Mareti, Kinchit Cha Ashanivat Sadhyu Mareti. So the more you use the medicine without knowing what it is, the more the risk is. So study. So now what Charaka is telling, how the physician will not become a danger to society. That is the next concern. The physician has so much decision-making power and the patients are all surrendering to a physician. So you have to be So he is telling Aushadham hi anabhijñātam nāmarupa gunaistribhi vijñādam chapi duryuktam anarthayopapadyate. So nāmarupa gunairityanena trutve labdhe punastribhiriti vachanam ekaika jnana pradishedhartha. It is not enough if you know only nomenclature or you know only the identity or only two of them. You need to know all the three. Then only you can be considered as complete. So he's mincing no words there. Tera tribhireva militer jnanam jnadam bheshajam prashastamidi darshedi. Tribhireva militer jnadam bheshajam prashastam. So then comes the remaining discussions. Yogadapi viksham tikshnam uttamam bheshajam bhavet. So once you know what a medicine is, see, this is the power. Marma means vital organ, like heart, brain. If any of those organs fails, you are dead. Mareti iti marma. When there is some cheda that happens to such organs, you are dead. So a marma is that which is sadhya pranahara, means kills immediately. Or it could be kalantara pranahara, will reduce your lifespan. So the mahamarmas are the ones that if they are damaged, it will kill you immediately. Sadhya pranahara. So brain, heart, kidneys, lungs, these are all mahamarmas, because if they are injured, you are dead very quickly. If there is big, and this injury to the marma is classified also in Ayurveda, depending on the degree. So if somebody comes to me and I want to make assessment, oh, marma is affected, is it the mahamarma? And among the mahamarma, trimarmas are the most important. Shiro hridaya vastyadi marmani. So I see if there is only a stress on the marma, it is called upatapa. If there is a moderate injury, it is called upaghata. And if it is a very severe injury, it is called abhighata. So even if it is a mahamarma, so the degree of injury or damage is also important. Even if it is a mahamarma, if it is only an upatapa, then you may not die. So I will type down those terms. Upatapa. Upatapa is a stress. Upaghata is a moderate injury. Abhighata is severe injury. So for example, we can say angina is like a upatapa. A mild MI is upaghata. But a very severe MI is abhighata, which may damage very large segment of the cardiac muscle. So stroke is also like that. It is called cerebrovascular accidents. It's like an internal trauma. Our Chakravarani clearly tells this is doshakrita abhighata. Doshakritu abhighata. It is an injury caused by internal mechanisms to these organs. So these injuries need not come from wounds or trauma from outside. It can be a sequel of metabolic events, internal injuries, internally mediated injuries like CVA, a cerebrovascular accident as they call it. Then Sadhya Pranahara. Those injuries to vital organs that kill you immediately. Kalantara Pranahara. Because once you get an injury, then your lifespan reduces by 1 decade or 2 decades. But you don't die immediately. Then we have Then another problem could be that Rujakara, that after that injury you are in pain. You have to live with some discomfort. You may not die, but you are having a loss in quality of life forever. You are in pain. This is very common with the cervical vertebrae, lumbar vertebrae, knee joint. These are all marmas. Once they are damaged, then you live with pain. Even after surgery, sometimes it's not exactly like before. Then you have Vaikalyakara, which means it causes some disability. You will not die, you will not have pain, but you will have some disability. You may limp, or you cannot run like before, and things like that. And then finally, we have Vishalyakna, irreparable injuries, where if you attempt to repair, the person will die. So there is a piercing rod inside, person is alive, but the moment you remove it surgically, they collapse. It could be because a major blood vessel is impacted, and when you try to remove that intruding object, the bleeding becomes uncontrollable and the person dies. But when the marmas are not affected badly, even big injuries may not be life-threatening. This is the concept in Ayurveda. They also studied the tithis and found that on certain days in the cycle of the moon, our marmas are more vulnerable when we see so there used to be old advices, don't go out on this day. It doesn't mean that you will definitely die with an accident. If there is an accident, you will be more vulnerable on those days because your body, when you fall or when you break a fall, this is something which we should study. I am just telling the concept. I have not verified this scientifically. That we say that our marmos may be more exposed on some days. There is a concept of Amrita kala and Vishakala which keeps shifting in our body. So it's like when you fall, some people when they fall, it may be a very small fall, but they die. Some others, they may be engaged in a very big accident, but somehow their vital organs are. I have read stories about people in whom sharp objects have pierced their brain, but somehow escaped damaging the vital parts and they have survived. There's so many such stories. I used to collect all these things. How sometimes people survive miraculously. When you look at the scene, it looks like they're dead, but no. It's like they have 9 lives. So many mysterious things are there. Ayurveda tries to discuss and correlate. So they found certain days are not so good for travel because if there was to be an accident, then your injuries may become more severe. Things like that. So all these this whole Marma Shastra is very elaborate. So we need to study that in more great detail. So once we have understood about the drugs, योगादपि विषम तीक्ष्णम उत्तमम भेषजम भवेत् भेषजम चापि दुर्युक्तम तीक्ष्णम संपद्यते विषम. So what happens when you know thoroughly all these substances? You become empowered to use poison also. You can use poison also in a safe way if you know it. If you do not know it, you cannot use medicine also in a safe way. That is why you must learn all these substances very thoroughly. Yogadapi visham tikshnam uttamam bheshajam bhaved bheshajam chapi duryuktam tikshnam sampadyade visham. So yogadapi, that is if you are using it in a proper way, Visha itself becomes Uttama Bheshaja. So it is that yukti that is the basis of medicine. It's not that everything is always safe. Today I was watching a medical serial. I like to put things in context, and there they described chemotherapy in a very nice way. Chemotherapy is like beating yourself with the brick, hoping that the cancer will die first. It was a very nice dialogue. It's an American serial. The person is arguing that he would like to go for a clinical trial of a targeted therapy rather than do chemotherapy. And then his doctor is asking him why, because he's saying chemotherapy is like I'm trying to beat myself and hope that it will be the cancer cells that die first and not me. So, treatments are evolving, but we have to use the best shots available. I mean, we cannot dismiss any of these treatments just like that. We have to weigh the pros and cons and see what is the benefit. So, on the other hand, bheshajam chapi duryuktam tikshnam sampadhyade visham. So, it is not medicine. Today, everybody in Ayurveda, they are focused on, oh, ashwagandha is good. This is the warning given. Nothing is good or bad. If ashwagandha gets into the wrong hands, it will create havoc. It can bring disrepute to the whole system of Ayurveda in no time, which is what is happening today. Everybody is taking ashwagandha. During COVID, everybody was using it without knowing what it is. If you ask average people, do you know what it is? They don't know. So the text is giving a public warning. Tasmat na bhishaja yuktam. Yukti bahyena bheshajam. Dhimada kinchidadeyam jividarogya khankshana. It's an appeal. All people in the world, please listen. If you are desirous of your jivitam, your life, and arogyam, your health, and please don't take irrational prescriptions. Please don't follow irrational prescriptions, even if it is coming from a physician. Yukti bahyena vishaja yuktam bheshajam dhimada kinchidadeyam. Don't take that prescriptions. Just discard that, refuse prescriptions that are not rational. So this shows that in Caraka-Saṁhitā, blind faith in a doctor was not encouraged. Oh, he's a Vaidya, he's having a big beard and he has put all the, sandal paste and bhasma on his head, so we have to believe him. No. Here it is very clearly mentioned, it's a public warning. Don't trust anybody, trust in yukti only. So the Vaidya has to explain the yukti to the patient, which is not always done. We have to educate people more. The general public should become aware of these statements from Caraka-Saṁhitā, so that the misuse that is happening in the name of Ayurveda will be reduced. So we have to see in clinical trials, we are supposed to give get an informed consent from the patient. Why? Because we have to explain to them what they are going to take, and they should take a conscious decision. We cannot hide information from them. We should tell everything. So this is almost like an informed consent procedure that Charaka is telling here. What is the yukti behind using this medicine? And what are the risks and benefits? Then there are some very strong statements now. Kuryan nipadito murdhni sashesham vasavashani sashesham aduryam kuryan natvatyamadam aushadhi. See, even if a strong lightning has fallen on a person's head, he may survive. But Ajnamadam Aushadam, you cannot survive from that. It is a very dangerous thing to take irrational medicines from anybody. No chance of surviving. So powerful he is. And then he is telling what are the Dukkhidaya, Shayanaya, Shraddadhanaya Rugine, Yo Bheshajam Avijnaya Prajnamani Prayachadi. If a patient is coming to you and you are as if you are thinking that I am an all-knowing doctor and giving medicines without knowing what it is. To a patient who has come to you with dukkha, Dukkhidaya, he is sad, he is in sorrow. Shayanaya, and is bedridden. And his Shraddadhana is having so much faith in you. And you are what we are doing. Yeshajam avijnaya, without knowing the medicine, prajnamani prayachadi. Putting on a face of great wisdom, we are giving irrational prescriptions. Tyakta dharmasya, papasya, mrityubhudasya durmatehe, naro narakapati syat tasya sambhashanadavi. Such physicians are dismissed by saying, Tyakta dharmasya, they have forsaken all the dharma. Because they are cheating their patients. Mrityubhudasya papasya durmate. So their intellect is completely, damaged. They are the messengers of death, the highest sins, because they are hoodwinking their own patients, not explaining to them clearly, trying to, tempt them to take our medicines. Naro naragapati syad. If somebody even speaks to such vaidyas, they will go into hell. Tasya sambhashanadapi. So such physicians, we should not even talk to them. Avoid them. Completely avoid them. Boycott. So he says, Naro narakapati syad tasya sambhashanadapi. It's so powerful, So Dukkhidaya, Shayanaya, Shraddadhanaya Rogine, Yo Bheshajam Avijnaya, Prajnamani Prayachadi, Tyakta Dharmasya Papasya Mrityubhutasya Durmate, Naro Naragapati Syad, Tasya Sambhashanadapi. So this is the biggest responsibility. You have to not just prescribe a medicine, you have to enlighten, educate the patient, make him participate in the healing with knowledge. You have to tell, okay, this is the best that I know. These are the odds. This is what is. And then they can take a decision. It's always like that. A physician is not a Prabhu of Ayus. He is not a god. But his responsibility is to tell the patients always, what is the best I can do? This is what I know. If you do this, this is what will happen. Akriyayam dhruvo mrityuhu. Kriyayam samshayo bhavet. This has been told, Pratyakhaya Chikitset. About a surgery in Ayurveda, it is mentioned. Get permission from the king. Explain that Akriyayam dhruvo mrityuhu. If I don't do anything to this patient, he's definitely going to die. Kriyayam samshayo bhavet. But if I do this treatment, there is a chance that he will live. So should we take the risk? This has to be explained very, very clearly. This is all the process of consent. So not only for clinical study, this is actually to be practiced for even in treatment choices also. Before a treatment is administered, we have to explain. But it has to be explained, and it doesn't mean we have to frighten the wit out of the patient always so that he will say no to all treatments. That is not what is intended. It is making them consciously part of this whole, process. Varamashi vishavisham. Kothidam tamramevava. Pitam atyagni santapta bhakshita va pyayoguda. So instead of doing medicine, practicing medicine like that, you go and take the most deadly poison. It's better than practicing medicine like this. Or pour some molten copper down your throat. It's what is told to physicians. If you are, instead of cheating patients, you better pour some molten copper down your throat and kill yourself. Bhakshida vapya, Agni Santapta Bhakshida vapya yoguda. Natu Strutavadam Vesham Bibhrada Sharanagadat Grihitam Annam Panam va Vittam va Rogapedidat. So that is better. Put molten iron balls into your mouth. It's better than getting annam panam or money, taking food, water or money from Rogapedita, from a sick person. Should never do that. So this is the big responsibility of a Ayurveda physician, that he should act with knowledge. Complete knowledge, as much as is available, and the best knowledge. This is what today we are talking about, the best evidence available. The best knowledge available should be used in the interest of the patient, and the physician is fully responsible for that. He cannot mislead a patient. He cannot act upon incomplete knowledge. If the best available knowledge is incomplete, then that has to be intimated to the patient, saying, see, this is the best treatment available today. And with this, we are not sure whether we can save you. We can try. It should be very clearly mentioned. So this is the highest commitment. I don't think these statements can be improvised today. These are the highest ideals of ethics and nobility in the profession of medicine. Ayurveda set very, very high standards so many thousands of years ago. And today, even we all, when I was a student, I thought after studying 5.5 years, I become a sarvatnya and nothing else to be done. But Caraka-Saṁhitā clearly says, Bishak Bubhushuhur Matiman Ata Swaguna Sampati Param Prayatna Matishtet Pranadasyad Yathanranam. So if you want to become a physician, please work on Swaguna Sampati. Please try to improve your abilities. Param Prayatna Matishtet. Day and night, strive to make yourself more and more skilled. Continuing medical education, Satata Adhyayanam Kuryat. Param Prayatna Matishtet. Keep reading, keep understanding. Nachaiva Hyasti Sutaram Ayurvedasya Param. Do you know what is the best? Nothing else should be bothering you. For my patient, am I able to give the best knowledge that is available? How can I keep improving my skills? So Swaguna Sampadi Param Prayatna Matisted, so that you become a Pranadasya Yathanranam. You become a giver of prana, not a taker of prana. So the ability of a physician to save lives rests on clear knowledge. Knowledge, not superficial, but very deep, as much deep as you can go. So that even a poison you can use, even a sharp instrument you can use to save a person. And a sharp instrument with which one cut can kill a person. With many cuts, we are saving a patient. Shastram Shastrani Salilam Gunadosha Pravartaye Patrapekshininyata Pratnyam Bahushrutyena Brahmayet. Shastram, a weapon, Shastram, science, Salilam, water. Whether they benefit the world or harm the world depends on the Patram, who holds it. The Shastra in the hand of a murderer can unleash terror and kill thousands of people, like it is happening in the US every other day. Shooting spree. Innocent people are killed because that is a weapon in the wrong hands. There, everybody can keep a gun if they want. Shastrani. Science is also like that. Today, people are being killed in hospitals to harvest organs. A big racket recently came up in Kerala also. A very, very famous hospital was involved in this racket. So, Shastra Jnana is being used to exploit people. So it is because of this lack of this Shuddhi in the Manas, Dharma. Salilam, water. Water also, the purest water, if it's kept in a dirty vessel, it becomes contaminated very easily. So, building the character of the physician and enriching it with knowledge, both were considered essential parts of medical education in ancient times. So, on the one hand, the person should have a very clean moral responsibility. And the second is that both are needed. Amma, our guru at our universities of chancellor, she always gives a very nice example of how both should come together. The story of a monkey who, seeing a fish jumping out of the river, thinks that the fish wants to come to the shore. So out of compassion, out of real love for the fish, the monkey catches the fish and puts it on the shore. And then the fish, just in a few minutes, dies. And the monkey becomes so sad. Said, "Oh, I wanted to help the fish. Actually, why did it die?" So, just having compassion is without knowledge is like this. You may want to save a person, but if you don't know, like cardiac resuscitation, if you do not know how to do it, then simply doing something wrong will kill the person. You may have love, you may have empathy, but knowledge is also necessary. On the other hand, if you have knowledge but no empathy, then you will not be able to help people in the right time. So both have to come together. Both knowledge and empathy are needed together. That is what Caraka-Saṁhitā is trying to inculcate here, saying that you need both. So we talked already about Bhutadaya, Maitri, Karunya Marteshu. All those concepts are there on one side, and that alone is not enough. You need precise, advanced knowledge also on the other hand. So a physician is a coming together of two things. And that is what is lacking today. Bhutadaya and Jnana. Aushadha Jnana. Or Ayurveda Jnana. Or medical knowledge, whatever it is. With all the skills. When these two things come together, then you have a really powerful medical profession, a very powerful healthcare delivery system that can respond to societal needs, empowered with empathy and with knowledge, both together. And somehow our current medical education is not able to create a balance. And when there is more skill, there is more exploitation. There is more manipulation. A lot of the medicines that come out of clinical trials are marketed with the knowledge that they will harm, because there is their interest to create money. By the time the side effects are discovered, the companies have already made the money. Many things like that have happened again and again. Statins are now under the scanner for. So if you look at Ayurveda also, it has become very commercial. All the products that are happening now, they are not tested rigorously, they are not validated. We don't know. And Ayurveda people are very, allergic to any criticism also. So that we have to get a guideline from Charaka. Vishak Bhubhushur Matiman Ataswaguna Sampadi Param Prayatna Matishter Pranadasyad Yathanranam. So these are all very important.
Sir, one more thing, sir. So about the anti-diabetic drugs which are promoted with Ayush and all,
Yeah.
they're generalized.
Yeah, they are generalized. See, the problem is there has been a lot of pressure also from the whole scientific community to make Ayurveda imitate the modern approach. So, see, if you ask any public health expert, they will say, you please don't complicate things. Please come with one simple medicine. So the CCRA's government, they are all under pressure to produce single herbs and single medicines. The whole system approach of Ayurveda is lost. So we will definitely, if you give the same medicine to everybody, then we have to make it very more powerful by changing the whole method of pharmacological development. No Ayurvedic medicine will work on one disease in everybody. I can guarantee that with my experience. But unfortunately, that is how it is being marketed. Many things are marketed that way. Did I answer your question, madam? Did I answer your question?
Yes, sir. Yes, sir. So that's what I'm thinking, like, because the tridoshas, I mean, it will be different in each patient.
Yes.
So
We have to,
customized
yeah.
treatment should be.
I got one chance to do a study on rheumatoid arthritis in this way, and we found that instead of giving single formulation to everybody, when we customize it, it is much more effective. Shreyas has asked a question. I didn't understand. Which series?
Sir, you mentioned about some American series, medical.
Okay, that is New Amsterdam. It's about a public hospital where the
Yes,
medical director wants to actually help the patients rather than make money for the hospital.
it's a
And
very nice series.
yeah, it's a very nice series. Oh, you are watching it?
Yeah, I watched it.
Okay. Because it is based on some medical ethics. That's why I got interested.
Yeah, that series is very different from other medical
Yeah,
drama.
other medical drama.
Focuses more on patients and
How to help patients. What is the real
yes,
drama of a doctor? That is the focus of this series.
yes.
Yeah, somebody said something. What is it? So the last thing is Ayurveda does not directly speak about Ida Pingala Sushumna. This is from Yoga Shastra. So Ayurveda people knew that because they studied yoga also, not directly in the Ayurvedic textbooks. I have not come across any description in any classical text. I've also been intrigued by it. Okay, so then that's it for today. Yes, Sumitra?
Sir, is there any separate text that talks about Nadi Chikitsa per se?
Yeah. There is Ravana Nadi Shastra is there. Many small books are there, Prakarana Granthas. It first comes in Sharangadhara-Saṁhitā.
Which
First,
Samhita?
Sharangadhara-Saṁhitā.
Shardhara.
Sharangadhara. 13th century, around that time. Then there are many other small granthas, Nadi Prakashika. They are all available in Chaukamba. You can check in the Chaukamba catalog, you will get a few of them. But none of the books are elaborate enough with all the
Okay.
details that actual practitioners know. Nobody has documented it because it was transmitted from Guru to Shishya. It's a skill that cannot be taught by books. That is why less books are there on that.
Okay.
Okay, so namaste. See you next week.
Thank you, sir. Namaste.
Namaste, sir. Thank you.
स्थापकाय च धर्मस्य सर्वधर्मस्वरूपिणे अवतारवरिष्ठाय रामकृष्णाय ते नमः। रामकृष्णाय ते नमः।